is 4:02. Good afternoon and welcome, everyone. My name is Lynn Duran, and I am the Assistant Dean of Student Affairs in the College of Public Health. Thank you so much for joining the virtual MPH Applied Practice Conference Student Highlight event. That was a mouthful. We are so excited to have you all with us today, including current students, faculty, preceptors, and prospective students. We would like to take a moment now to respectfully acknowledge the University of Arizona is on the land and territories of Indigenous people. Today, Arizona is home to 22 federally recognized tribes. There are many others that aren't, with Tucson being home to the Atam and the Yaqui. Committed to diversity and inclusion, the university strives to build sustainable relationships with sovereign Native nations and Indigenous communities through education offerings, partnerships, and community service. As you may know, our Master of Public Health students from the Tucson, Phoenix, online, and global MPH programs conduct applied practice experiences in communities around the world. The applied practice experience serves as an integral part of the MPH degree curriculum, in which our students are able to utilize their academic knowledge from the classroom in real-world practical situations among professionals in the public health workforce. These hands-on culminating experiences benefit students and organizations alike. We are so profoundly grateful for the collaborations between our students, faculty, and agency preceptors, and are very proud of the contributions our MPH students have made to the field of public health. This virtual applied practice experience conference is our opportunity to showcase the breadth and depth of public health work that our MPH students have done with local, national, and global communities. Coming up next, you'll hear from some of our MPH presenters and learn more about their amazing experiences. After our student panel, we will be providing some additional details about the conference and how to view our fantastic student presentations. Thank you.
Thank you, Lynn. Again, welcome everyone. My name is Kim Barnes, and I'm Director of Student Affairs for our Phoenix campus. And we're very happy to welcome our student panelists today. We have with us Chidera Ejike, Rachael Hinkel, Kerry Johnson, and Jen Strozewski, and they cross our campuses, actually Tucson and Phoenix campus represented today. I'm going to introduce each of them by way of their brief bio, and then we'll launch right into questions. We do have some prepared questions, and then we'll open it up to the audience for discussion and questions that you might have. So first up, we have Chidera. Chidera holds a Bachelor of Science degree in biotechnology and is currently a second-year MPH epidemiology student. She's working as a graduate research assistant with the Cohort GI project, as well as the University of Arizona Student Aid for Epidemiology Response, or the SAFER team. Her internship research involves evaluating the impact of food insecurity and social outcomes on the severity of acute COVID-19 and the incidence of post-acute, I'm not going to say that word right, Chidera, of COVID-19. Chidera's research interests include infectious epidemiology, disease prevention, disease surveillance, antimicrobial resistance, and rural health. In her free time, she enjoys going for leisurely evening walks with her daughter, sewing, and watching quality movies. Rachael Hinkel is completing her final semester as an epidemiology student in the MPH program and will be graduating in May. Her interest in public health began while volunteering for peer health exchange in Los Angeles while earning her undergraduate degree from Occidental College. She served as a Peace Corps volunteer in Guinea for 2 years, working on initiatives related to malaria, sexual health, and maternal and child health. Last summer, she traveled to Zambia to conduct epidemiological research for her applied practice experience, titled Evaluating the Referral Cycle of Cancer Patients with Cervical Lesions from Screening to Diagnosis in Lusaka, Zambia. Rachael will be transitioning to a new role as an epidemiologist in the Community Mental Health and Addiction Department at Pima County after graduation. Kerry Johnson has been a part-time MPH student since 2020 in the Health Behavior Health Promotion concentration and plans to graduate in May. She's passionate about enhancing equitable access to health programming and knowledge among low-income and underserved communities. She's worked to promote access to clean water in Honduras and Nicaragua, support teen optimal health and pregnancy prevention in the Arizona-Mexico border region, conducted community health assessments focusing on reproductive, mental health, food, and physical activity environments, and assessed COVID-19 vaccine hesitancy among Southern Arizona adults. Jen Strozewski is an MPH student in the public health practice concentration at the Phoenix campus and intends to graduate in fall. The title of her applied practice experience is Integration of HIV Care and Cervical Cancer Screening in Sub-Saharan Africa. She has a bachelor's degree in biology from ASU and returned to school mid-career after working in the pharmaceutical industry for the last 20 years. Jen hopes to transition into health outcomes research when she's finished with her degree, with the ultimate goal of reducing health disparities in vulnerable populations. You all are amazing. I don't know if our attendees had a chance to watch the presentations of these 4 panelists. If you haven't yet, I'm certain you will be inspired to do so following today's session. But we're going to launch right into questions. So as I mentioned, this is a panel. So panelists, feel free to jump in, answer your questions. I might pick on some of you here and there. I did watch your presentation, so I might cue some things here. And then audience, if you have questions during the session, feel free to post them in the chat. After I ask a few, we'll then open it back up to the audience, and you can raise your hand, unmute, show your video, however you are comfortable asking those questions. So the first question I have for each of you is if you could briefly describe your applied practice experience, like 1 to 2 minute elevator speech type style, if you're given the short form about what you did, so that our audience can get a little bit adjusted to the content here today. And we're going to start alphabetically. So Chidera, you're up first for us.
Okay, hello. Thank you for the introduction, Kim. So my internship, like you mentioned, involved evaluating the impact of food insecurity and social outcomes on the severity of acute COVID-19 and the incidence of long COVID. So that's the long PSC. And so this was focused on the cohort study, which comprises of Arizona residents. So the cohort study is a longitudinal COVID-19 study that is focused on understanding the impact of COVID-19 on Arizona residents and the incidence of long COVID as an aftermath effect of COVID-19. And my roles during my internship were to assist in developing a survey tool that was used for primary data collection on long COVID, and also to conduct a data analysis to see if there is any relationship between food insecurity and acute COVID-19 severity.
Thank you so much. We'll pass that to Rachel.
Hi, like Kim introduced so nicely, my name is Rachel. I did my APE in Zambia, and I did my APE through the Cancer Epidemiology Education in Special Populations Program, or CESP for short. It's an epidemiologic student education program that operates out of the CUNY School of Medicine in New York City. And so it is structured in a way that kind of gives students the opportunity to go through the entire process of research study design, data collection, data cleaning, data analysis, and manuscript writing. And so I, through that program, spent my entire summer last summer in Zambia, and I worked with the Ministry of Health in Lusaka to collect patient-level data from cervical cancer screening facilities across the province. There are 10 provinces in Zambia. I just focused on the capital region province. And we used that patient-level screening data to link with histological confirmation data from the histological lab in Lusaka to kind of evaluate the time that it's taking patients to get from their initial screening to their confirmation of cervical cancer. And we were looking at it mostly between HIV negative, or women living with HIV, and those who were living without HIV. And so we were taking into account different facilities, different districts within the province, and all kinds of different factors that could contribute to why this timeline is the length that it is. And so we conducted a survival analysis to look at that timeline. And yeah, it was just like a fully comprehensive epidemiological research experience. And it was awesome. It was a lot of fun.
That's great. Thank you, Rachel, so much. Kerry, if you could give us some information about your experience.
Yeah, hi everyone. My name is Kerry Johnson. I'm in health behavior and promotion MPH concentration. And so my internship for my degree focused on program evaluation. And I did my internship with CHEC, or the Southeast Arizona Health Education Center. They focus on improving migrant and border region health through advocacy, education, and action. And I had 3 core projects or deliverables within my internship. CHEC was just launching last year a mental health curriculum for Latino seniors and also to be reaching other populations. And so they needed technical support to create an evaluation plan for that program. So I supported the team working very closely with their community health workers, or CHWs, to design that evaluation plan. And then I also worked with the team to create a cost benefit analysis tool. This was created in Excel, many hurdles of learning and challenge and success to come up with a really accessible framework and approach of how we could assess the costs, the financial costs, and the health-related costs and benefits for attending this educational program. So they could have a greater and more holistic tool in advocating for and validating the benefits of this education curriculum in rural communities. And then the third project that I focused on was in response to a recent state policy. So the state recently approved the voluntary certification for community health workers at the state level. And then Access, our state Medicaid provider, recently also announced that community-based CHW programs would be able to be reimbursed with state funds from Medicaid or Access. And so I reviewed that policy and essentially created a step-by-step path to eligibility to reimbursement for CHEC, so they could look at if this was beneficial for their agency, what would need to change in terms of their program model to become eligible, and how this might influence their bottom line and financial sustainability. Those are my 3 projects.
That's amazing. It's a lot. I'm always impressed by the depth, but also the breadth of the projects that each of you are doing, and then between your projects as well. And then last but certainly not least, Jen, if you could let us know a little bit about your project.
Thank you. My name is Jen Strozewski, and I am finishing up next semester in the PHP concentration. I did my research project remotely, but the internship site was a hospital in Nigeria that specializes in caring for women with HIV. And the connection with cervical cancer is that HIV is one of the strongest, greatest risk factors for cervical cancer diagnosis. And because of the large burden of HIV disease in Nigeria, Nigeria has one of the greatest mortality rates in the world, actually, twice the global rate. So for mortality for cervical cancer. So this research project was a qualitative analysis looking at 98 interviews of patients with HIV and providers, and really just trying to uncover what are the facilitators and barriers to screening for cervical cancer, with the ultimate goal of increasing uptake in their patients. Because even though they offer no cost Pap smears for their patients who are receiving HIV medicine, they have a low uptake. And so that's what the research was looking at.
Thank you all. As I mentioned, that was the brief elevator speech for each of your projects. Again, watch all of their presentations, folks. They do an amazing job giving lots of details and really great insights into the experience and to the results from their work, and how it'll impact the public health sphere. My next question is something that I think many folks in the room, particularly students who haven't done their internships yet, and forgive me, internships are the same thing for us as applied practice experiences. I want to make sure folks in the room who might not be familiar understand that for us, those terms are interchangeable in a colloquial or practical way. So I'll say both things, APE and internship. But folks might be interested in learning how you found your experiences. Rachel, I know you mentioned you found yours through CEIS. but there's more details in like how that actually happened. So we'd love to hear actually from each of you about how you found and secured your internship.
Okay, I can start. So yeah, I did my project through CESP, which as I described is not an organization affiliated with the University of Arizona or the state of Arizona, but it is a partner organization. The director of the program is actually a alum of the PhD program at Mezcoff. And so he sees a lot of value in the University of Arizona public health students. And so I think he makes a point every year to kind of reach out and gauge interest. And so I went to an information session that he and a few of the alums of the program put on my first semester in my MPH program. And so the application process for CESP is pretty extensive. And so I think I went to the information session maybe around September or October, and then got started on my application process November, December-ish, and then heard back that I had been accepted early March and then left for my internship in May. So it was a pretty long-winded timeline.
Yeah, that's very early. Usually we're telling students to like settle into their curriculum and their MPH coursework in September. But it is good to hear that programs like this, your application process is very early in your MPH. And so that's something to think about for students who are interested in this type of work is sort of that advanced planning. Kerry, can you tell us a little bit about how you found your experience?
Yeah, absolutely. I have a very different approach to how I chose and secured my internship. So as my bio suggested, I started my MPH journey in 2020. So this has been a 4-year experience, which meant that I was able to start building some significant connections and networking, early on in my experience. And through a class called Milagro, which focuses on migrant health and border health issues. I met Gail Emmerich, who's the director of CHEC. And so that started my connection with CHEC and learning about what they do. I then a few years later, I took a public health finance and budgeting class with Dr. Gail Barker, who's on the call today, and got really interested in this idea of how do you measure the financial and health related costs and benefits of a public health program. First, a lot of folks in the world don't know even what public health is. And then how do we even talk about the measuring of these education and public health activities? So that got me really inspired to pursue a project focusing on that issue. I reached out to CHEC to explore if they were interested in hosting an intern. They were interested, and that's when I learned about their need to create the evaluation plan for their pilot curriculum. And so this was a merging of my interests and their needs, my kind of long-term networking and connections with this region. And I'll just add lastly too that this was an unfunded project, but initially, so there wasn't any kind of stipend or anything tied to it from the beginning, but I applied to some internal funds through the university, through the College of Public Health, the Western Region Public Health Training Center, and then CHEC did actually have funds allocated for evaluation support. And so through all of these resources, I was able to actually fund my internship as well. So couple unique avenues there.
That is amazing. So I just very quickly to compare, right? Rachael did a very typical apply to an experience, although there is that connection piece with going to the workshop in the first place, going to the seminar in the first place, then applying. And then Kerry, I think you found your experience in a similar way to many of our students, which is through sort of offsite networking, relationship building, and then a conversation of, well, this is where I am interested. What do you need and what are you interested in? And sort of marrying the two for a really great experience. And thank you for sharing the information about funding. Many experiences are not funded through the agencies. They need the support. They often need free support, but there are other avenues to research in terms of funding your experience. And we have several of those that we often advertise, and we're so happy when we hear students who have partaked of those. Jen, could you tell us how you found your experience?
Yeah, so I kind of stumbled upon it in a way. I listened to one of the global health speaker seminars. Well, I listened to several, but And that was just offered by the college, and it was done by an alumni who, she had already completed research in Nigeria, and she was presenting some of her research. And so I just kind of contacted her on LinkedIn because she's currently working in the field that I want to go into, and just made that connection. And then aside from that, several months later, I saw on the hub that she was posting an internship or applied practice experience opportunity. And so I contacted her, and it was a great fit because I was already interested in what she had studied and kind of listened to her like preliminary presentation of it. So it was just kind of an accidental find.
Well, I mean, I think there's definitely some purpose there. There was some
Well, yeah.
intention there.
It was initially, I didn't know that that was the purpose.
Yes,
I mean,
it was a
yeah.
happy connection, happy accident. I love that too. I love that you had already made a connection with her, right? You attended this workshop, you reached out, and then this experience came up. And I think that that's a great showcase of, again, the importance of expanding beyond the classroom and hearing what folks are doing, and in particular our alums, right? Because they're doing great work. And I think to Rachel's point, our alums understand the value and the skills that our MPH students are gaining in our program. And so they know that you're going to make these great interns, right? You're going to be able to do great work. And that familiarity with the program. And in many cases, especially with our MPH alums, the process of the experience, they understand what you'll be doing for your internship. And that's really helpful in terms of a mentoring moment. Chidera, could you tell us a little bit how you found yours?
Yeah, sure. Networking also played a role in how I found my internship, just like every other person in the room. I remember then when I was looking for my internship, I was interested in remote positions because I had a 1-month-old daughter. So I didn't want anything that I would travel or anything I would have to be in person because of time. So I started making applications, but I wasn't really getting anything at then. So I decided to work internally within the university as it would make it easier for me to be there for my child. So I started reaching out to professors that I had taken their classes, and I loved what they were doing in research. And Dr. Pogriba Brown was doing something was the PI of cohort, or is still the PI. So she mentioned that I could work with her on the internship.
That's fantastic. I know remote positions are often sought after for a variety of reasons, right? You work full time and have family obligations. You have a 1-month-old. I remember seeing her on Zoom calls, adorable, right? So I think there's particular experiences like that where if you know you need something and you're looking for certain things, right? Sometimes it's reaching out and saying, here's what I need and how can we make this work? And I think Jen and Chidera, it seems like you both really valued that portion of your experience and needed that for your work-life balance, which I think is important in that consideration as you're developing your ideas and researching opportunities to know what will help you achieve that balance whenever possible. Well, thank you all. That was a great to learn a little bit more about how you found those. So the next question that I'm going to ask, and then we'll open it up to the audience, is I'd love to hear about any unique experiences you had during your internship. And I know that's a tough question. When I say unique, it could be really great, really surprising, really bad, like anything that you think that is a standout experience for you or a standout moment, some connection you had. I just love to hear a little bit. Those are things we don't hear in your presentation, right? So something really like that fueled you or anything like that. And I won't call on anybody because I don't know if you all feel like you have an experience like that to share, but if anybody does, we'd love to hear it.
Okay, can we start? Well, for me, also because it is remote, having a remote internship kind of limited me in a way that in-person internships wouldn't. But I did love my internship. And one of the unique things I loved about cohort was that there were different professors from different backgrounds in public health. And I really loved attending the meetings and networking with them because it kind of gave me different perspectives and had me look at COVID or the projects we're working on from different angles. So I think that was a very unique thing for me during my internship.
Thank you, Chidera. Yeah, I think that's networking can be very tricky in the Zoom environment, but when you're able to learn from different folks, especially faculty in that experiences, that's remarkable. Kerry, I saw you had unmuted as well.
Yeah, I can share a little bit. So one of the things that CHEC does a really great job of is knowing very closely and intimately the communities that they serve. And it's through traveling through Southeast Arizona that they get to do that. And so I was able to shadow their team of community health workers across in Nogales, in Graham and Greenlee counties, and also in the migrant shelter here in Tucson, Casalitas, to understand a little bit more on the ground of the work that they do, how they serve communities and addressing health disparities, but also how they learn from those populations to adapt their programming. And then some of those principles were incorporated into some of the work that I did. And then on the note of networking, I was able to attend the ASCHOW conference in the summertime, which is where I met several of the folks that I actually interviewed later on to support the policy assessment for access reimbursement.
That's excellent. Yeah, in your presentation, you talk a little bit about how you incorporated things like right away into the evaluation plan or right away into the survey to make things as simple for folks. I think there was translation and there was ages and size of font for reading. And I thought that was a really great portion of your experience to be able to sort of do that live updating during the pilot phasing. Rachel or Jen, anything you want to share about your projects?
I can, or Rachel, were you going to go?
No, you can go.
So something just kind of, I think, surprising for me was I had this idea of what qualitative data analysis was before I actually did it. And then, then when I started doing it, I realized it's not as clean as I had imagined. Like I pictured there were questions that were asked and then there were responses, and it was just a simple matter of putting them into buckets. But it was like, it really felt like one of those word searches where you're like, where do I find the hidden word, you know? And people would go off on tangents and they'd be like, oh, do you know so-and-so? I know I met her at the market. And I'm like trying to, you know, get to the heart of like the actual questions that we're asking. And so that was really surprising to me. I just kind of hadn't factored in the obvious human component of you're having conversations with people and it's not as, you know, one-to-one clean.
Yeah, like you think it's actually just like a survey that people speak their answers and that they're speaking how they would maybe select an answer, but it's a conversation and you have to, and when I was watching your presentation, yes, you have a tool that helped you do that, but you had to filter down what someone was saying. And there is a subjective component to sort of being able, the humanity, right? To be able to human translate that into a data point, I think is very, very tricky. So well done for you. That would be very, very challenging. Rachel, you unmuted as well.
Yeah, I'll just say something real quick. So I think the most unique aspect of my experience was actually my site preceptor. So he's a Zambian national, but he got his MPH in the United States, and he also is an alum of the CEASE program. And so he was so well informed and well connected in like the Zambian health system. He was understood how MPH programs in the United States works in terms of like what my requirements were for my internship. And then he also understood like the CEASE program itself. And so I think I got extremely lucky having him as a preceptor because he was so helpful. And so like any question that I had that came up, he could look at it from 3 different directions. And it was like, of course, doing an internship, an APE in a different country, I had many frustrations that like we've talked about before we started the call, just in terms of like pace of work, pace of life, different culture, different language, all kinds of stuff like that. But just having him as my preceptor to really kind of bridge all those gaps was really, really unique. I think, especially compared to the other students that were in my cohort, just a very unique, valuable person to have on my team for sure.
Wow. I mean, it definitely sounds like that. It sounds like in multiple ways, many of you, right, needed that connection to the community, whether it was through this preceptor who can do the different things, whether it's through your preceptor, Jen, who was already immersed in research and so had this kind of framework of background. Kerry, you mentioned you toured and you worked with the community health workers. And then Chidera, you reached out to faculty who you'd already had this relationship with, but who were also very immersed. I mean, the PI for the project, right? So somebody who is intimately knowledgeable about the work that's happening and sort of the value that our colleagues, our professional colleagues, preceptors, faculty are able to sort of make those connections and really be resources for you during those experiences. But Rachel, I think that that's fantastic, right? The 3 different angles, because you're probably saying, I know a little bit about this, but I don't know about this side of the coin. Like, help me understand how that would work. And so I think that's really fantastic. I would love to take a pause and open it up to the audience for any questions you have. You can have a question you pose to the group. You might have a question for somebody in particular. You can unmute, you can use the chat function. So I'll give you just a little space for a minute here to think if you have any questions. I certainly have more questions I can ask as well, but I thought I'd pass it to you all in the audience. Miss Dr. Gail Barker.
I actually have 2 quick questions for the panelists, and this is to help students that may be on the call in the conference that are just starting their internships or trying to find it. And so the first question is, was there any part of the internship that did not go as planned? So you had to refigure things, because these things are not all linear. And sometimes the students get a little upset when things don't go according to plan. So did that happen during your internship? So that's part A. And then part B is, what did you learn about yourself? In other words, did it help you solidify your career path? Did you learn that you could do new things? I mean, did it give you more confidence? So those are the 2 things I think would be super helpful for the students that are just now thinking about or just have not started their internship. Yes. Thank you so much. And you can go in any order, but I'd really appreciate hearing from all the panelists.
Yeah, I can start. So I think the biggest challenge and kind of the biggest cause of having to pivot for me was going through the IRB process. So since I was doing technically human subjects research, even though I was looking at retrospectively at health records, I had to go through the full human subjects research process with IRB, and it is a process. And so I found out that I had been accepted to the program in March, and I was scheduled to leave the US at the end of May. And it took up until the very last moment to get IRB approval and all of my paperwork turned in on time. And it's just because of the different back and forths between me and the IRB, the different clarifying questions I had, the different amending paperwork that had to go through it. It really is a really long, it was a great learning experience for sure, but it was a very long, challenging process. And so I think that was the biggest kind of need for flexibility for me, at least in the whole, like in the APE side of it. But then in terms of what I learned about myself, well, since I was in the Peace Corps, I wanted to kind of get back into the global setting and more of like a specialist situation, because when I was in the Peace Corps, I had just come out of the undergrad, and I was working as a public health educator, but I kind of wanted to get more into the granular level. And so I really appreciated getting that research experience and like the interaction with the data. But I did learn that I became more familiar with the politics that go on with academic research. And so it made me step back in terms of wanting to immediately pursue a PhD. I'm not quite sure. I'm sure it will come up again, but it really kind of pushed me into like, maybe I'm gonna pivot from the research track right now and kind of go into industry and see where I end up later.
I can speak next. Oh, sorry, Kim, did you want to chime in there?
No, please.
All right. Yeah, I can speak next. So I think and Dr. Barker, you were one of my advisors for my role, so you may recall this as well. One of the greatest challenges or things that didn't go as planned that I experienced was in the cost benefit analysis. So the structure of the health education program that CHEC had designed did not have specific behavior change goals or health outcome goals, like number of people that improve their A1C numbers with diabetes, diagnosis, number of people who receive treatment for depression to reduce symptoms. So we didn't have a clear target or a clear goal of where the program was intending to result in. And this was intentional on their part because it was an educational program. They covered a range of mental health issues that are present in their community. And the goal was to increase awareness and knowledge and then access to local services. And so in terms of designing the cost benefit analysis, we had some clear costs that were able to be quantitatively measured, but then creating the benefits side was really challenging. The literature speaks to a measure called QALYs, or quality adjusted life years, that are fairly common in cost benefit analyses, but it does require that explicit measurement. So a proxy that we really worked very hard to figure out what the goals of the agency were to be able to create some kind of outcome or output that was valuable to them, and not just, a number and focus on the cost. So we really pushed ourselves to think creatively, and think outside the box of those existing measures. And so we created this proxy measure, which merged essentially health-related quality of life and longevity together, which are really the two sides of the quality measure. And getting there was a journey, but I think this experience demonstrated that there's a wealth of tools out there, and the questions that you want to ask, there is some precedent, or there's some published article or example that you can learn from, and yet you still may have to do some adaptations in-house for what's most appropriate for the population and the site. And I think, all of that, I learned that, resiliency, creativity, and just continuing to push through the literature and learn what the tools are that are out there, can really help with finding that final push, or finding that final solution that, that really fits, right? That works for the agency. So that's what I would say.
Thank you, Kerry. Jen?
So I also, Dr. Barker is my advisor, and so I feel like this was also a little bit of a question for me in the sense that I had some plans to be finished in December, and that did not happen. I just didn't anticipate kind of how long it would take me to do the coding of the data. And so then I just sort of had to reevaluate. And there were times where I thought about kind of reducing the size of the project and not doing quite as many, including as many patients, because it's a pretty robust number for qualitative analysis. But I had already agreed to do that for my preceptor. And so I just kind of felt like this pull of like, this is what I want to do. I want to complete her research, even though maybe I don't need quite as much for my own sake, so but I still got through it. It's just I had to revise that, and so instead I didn't really finish coding until February, and then doing the analysis. But as far as what I learned about myself, during it I thought I will never do qualitative analysis probably in the future, but I now in retrospect I feel like because it was so challenging for me that I learned so much more than I would have if I had. That was the reason why I resisted it, was because it was so hard. And so now I've kind of I think I gained more from that than I would have if I had gone, a quantitative route. So it was a good experience. I'm glad that I learned so much from it.
Yeah, I can quickly add to that. So just like every other person mentioned, usually before you start the internship or when You kind of have the idea of what you want to work on. You kind of have a plan in your head that you think would work that way. In my case, when I saw my data, so the data was well collected, but then only for me to discover that a very important part of the data wasn't collected from the participants. So, and this is data I'm supposed to analyze. So usually it doesn't really work as we plan in our head. So it's like, I think Kerry mentioned, it then requires you to be quite creative to know what to do with the data you have and how to answer the research question, or maybe rephrase the research question. But it does need a level of flexibility. And what I learned was to go back to the basics. So sometimes, like literature review, you think, I've done this a couple of times, I know what it is. Or just basic data analysis, you think, well, I'm a pro in coding. But then when you have a rough data that it just kind of taught me to really make sure that I internalize everything I've learned in class and that I really know it to my fingertips. That way, no matter what data you're presented with, you kind of are able to work with it.
Dr. Parker, thank you so much for the two-part question, because I think there's so much power in the answers that we just heard, and so much really good advice. The back to the basics. All of you, really, I was so impressed with your literature reviews, your description of your literature reviews, and the sort of power that those have. Again, Chidera, thank you for saying that. We think they're so basic, but going back to those is often what helps us move forward, and finding the tools that exist already and seeing what work has been done. But I really value the creativity discussion, right? How do we get creative with our programming, with our evaluations, with our data, with our time, Jen? How do we get creative with how we have to think about, right? Because this is not how your brain normally wants to work. So how can you be creative and like set up your situation so that you can dive in to do something that is really hard? And then I think I'm hearing a common theme too of you're learning things that you don't like. I don't like this, or I'm not ready to do this, or I didn't like this part of it. And I think this is coming again from a personal component. I did an internship day 2. I was like, oh, this is not going to be what I do with my life. But it was an amazing experience. And I had to take from it, just like you all did, things that are really good. And then it helps you sort of reshape your path. Okay, this is maybe, I'm going to add this onto my path. I loved this part of my experience. I want more of this, or maybe not so much more of this, and maybe later. And I think there's real value in the internship experience, right? Your work that you've done, the results that you share in your presentations is amazing, but the actual like real life experience and how it affects you is really important for us to hear. So thank you, Dr. Barker, for those questions.
Well, I'd like to thank the panelists for their honesty, candor, and I think that this is really helpful for those students that are just starting their internships. Thank you very much. Really, very grateful.
Are there other questions from the audience? We have time for probably 1 or 2 more questions before we'll share some more information about our conference.
I apologize if this is a bit of a repeat. I had a health call to take care of, but I just want to get, if you didn't answer this question, because Dr. Barker's question was a great question, but in your next steps, like how do you feel good about your choice of your internship and preparing you for, your professional career? And do you have next steps that apply directly your internships, or are there things you wish you would have done to better prepare you for looking for your next step in your professional journey? And yeah, congratulations to everybody. This is super interesting and your projects sound great. I'll just go offline having said that.
That's a great question, Maya. Is, how do you think this is going to prepare you for your career path, or how is it going to lead you on your next step?
I'll start. So I think in terms of what I learned that I'm going to be carrying over with me, I became very familiar with both R and SAS and different regression analyses that I will be using in my role. An interesting thing that I didn't quite expect coming back from my APE and kind of getting into the the depths of job applications. I am so grateful for my APE and the experience that I had, but I did find myself when I got back thinking maybe with my goal of staying in Arizona for the time being, maybe it would have been a better avenue for me to apply to an APE that was more local. And so I could establish those local connections and network. I don't know if I would do it like I would do the same thing over again if given the chance, but I think I would have had a much easier time with my job path if I had kind of looked more locally.
That's a really great perspective to have, because it's an amazing experience, but does come with some challenges for that next phase. Other panelists.
Yeah, well, for my internship, I did enjoy my internship, and I think if I'm asked to choose again, I would choose it. But I think one part that I took away from it that informs my future career is surveillance is something I love doing and something I think I would do a lot in public health. So being given the opportunity during my internship to help in developing a survey to collect self-reported data and to work with self-reported data helped me to really understand how important it is that you look into the future while designing surveys, and how important it is that you really think critically, like how important data collection is, both in the data analysis and final reports. So that's kind of gave me, informed me kind of about things to think about while in future when working in platforms that allow me to do those.
Thank you so much, Chidera. I think that that's really valuable to think about what you learned and what you learned you don't want to do, or what you do want to do in the future. Those are really good lessons.
I can jump in here as well. I think that, so I currently work with the Arizona Prevention Research Center as an evaluator. I really have learned in my degree that I really enjoy program evaluation, and I came into my MPH with the perception that I was going to be a program manager, program director, upon graduation, just doing those direct services. But I also have now found this whole other avenue that I really enjoy, and this applied experience both on the education, creating the evaluation plan for an education program, and then looking at it from a cost and health benefit perspective of how these types of educations can articulate their benefit to communities. I think I now just have a much more well-rounded perspective of how evaluation should be such a central component into any and all programming. I started my MPH because I wanted to have a data-driven approach to direct service. And so I think this is just a great example and experience to lean on going forward. And I won't jinx it, but I'm applying to a fellowship with the CDC for doing very similar work. And so far I've been talking about this internship quite a bit. So I've really benefited already in my career search for that.
Oh, that's amazing. We're all crossing fingers and toes for you.
Thanks.
Jen.
I kind of mentioned I don't necessarily want to look into qualitative research in the future, but I'm still glad that I did the internship and the experience. As I mentioned, I think that if I were to do it again, ideally I wanted to, I work full time and I wanted to do kind of a project in at the pharmaceutical company that I work for, because I thought this will be a way for me to stay in my own company and then be able to transfer and move into a different role. But that didn't work out because of proprietary data and not wanting to have that be presented, and so that's why I sort of had to get creative and find another type of internship experience. So I'm still sort of at that point now where I can use this research to sort of present to people in my role and say, okay, now I'm ready to do something internal that I don't have to present, but that, can give me the experience that I want to be able to do outcomes research later. So it's still helpful.
Yeah, I was going to say that's a really interesting perspective, because often when we talk to students who do want to intern at their workplace, many of them don't have that same challenge. And so I think that that's a really helpful piece of information for us to have, faculty and staff who work with students, because yeah, we do have to think about that, and how you can gain the skills in a different experience, but how then are you going to apply it to the work that you really want to do? Or even shifting the experience in terms of data sharing and data presentations and how that actually works, because that is fairly tricky. So we'll talk more about that, because I think that's something worth exploring a little bit. Dr. Barker. Yep.
Yes, and we run into this quite a bit, even when students want to go to hospitals and do data, because the hospital administrators don't want their data, maybe wait times as you're looking at you know, bed availability, some of that thing. So there are ways that we have worked around that and given sort of more general information, but it is something that comes up actually quite frequently for the Health Services Administration students in particular, because of this sort of fear that their data is going to be presented to their competitors, even though they're not-for-profit organizations. So just something to keep in mind as well.
You'll both be hearing from me, I think, chat about that further. But thank you so much for the insight and again, your sort of vulnerability in sharing what is amazing and exciting for you, and maybe what is less so, or what has really been the challenge. These are all really important aspects of the experience. And so again, this is why we do these panels. We're so excited to hear this portion of your learning journey. I think we have time for just one more question, if there's a question from the audience. Otherwise, I have one more I can ask. So the last question we'll ask is really the closing one, which is, if you were to give one piece of parting advice to anyone looking for an experience, doing an experience, or doing the work, similar work that you did, what would that be?
The advice that I would give is the advice that I got from my first year, is that I really took and ran with, was not to kind of approach your APE as a box to check. Try and get as much out of the experience as possible. I know you didn't pay me to say that, but it really is so true.
I would have.
It really is so true, because I mean, there were a lot of challenges along the way with my APE that I think if I had chosen a different route, it would have been a lot easier of an experience, but I wouldn't have taken as much away from it, but I would have been able to check the box. And so that was the biggest piece of advice that I took away from listening to past students when I was in that position. So just passing it along.
It's fantastic advice for all of us, right? Don't just check the box. Other folks.
I would just give the advice of being open to experiences and just to research questions like very early on. So, you know, trying to take advantage of the different, you know, kind of talks that are sent out via email, and just kind of listening and thinking, not waiting until, you know, whichever semester it is where it says kind of like, here's where you should start thinking about your internship, like right from the very beginning, listening to those talks and saying, what are the things that, you know, make me interested and make me want to learn more? Because it sort of sparks those questions, and then you can kind of find which path you go down. So that would be my advice.
I love that. Yeah, from the beginning. We don't need you planning it, but we need you thinking about it, because that's going to fuel you and find your interest. Chidera.
Yeah, like Jen mentioned, start early, start asking questions, start networking. And I know networking can be a little bit daunting. But I also one other advice I got too was, don't be so don't constrain yourself so much about working in a particular thing or in a particular area that you're only looking for internships in that particular area, because sometimes internships kind of help us know which aspects we don't want to do in public health in future, and not just the aspects we love, something like that. So that was another advice that I got that I really liked. So it can also help you discover some parts of yourself that you didn't even know that some areas in public health that you didn't even know that you loved. So don't just constrain yourself to maybe a particular thing that you think is the only aspect of public health that you like. Kind of spread your wings a little bit.
Yeah, be open to learning more about the different facets of public health. Kerry?
Yeah, I have several things to add. I would just echo what's been said about being intentional for skill building, recognizing weaknesses in your own skill sets to take the opportunity of the applied internship experience to really spread your wings to build on those skill sets that you want to develop. That's something that I've been doing over the last 4 years, really intentionally with my coursework and choosing this project. And in that space, for example, I had really no clarity on the inner workings of Medicaid and billing codes, and now I do. I had never done a policy analysis that was applied in this kind of way and with health service providers, and so now I have that. I think the other thing is to say yes. So I walked into the internship planning experience with the projects that I had in mind, but then CHEC had their own needs that I needed to meet. And so saying yes brought this whole other dimension to my project. And then thirdly, I mentioned the funding in the beginning, but pay equity is a really big issue for public health internships and the public health practice in general. And so I just want to echo for those watching now or later that I applied to the Dean's Fund within the College of Public Health, Western Region Public Health Training Center, and there were other funds that I didn't apply to that are also available through the graduate college. And so for folks that are choosing internships that are non-funded structured programs, really to know that there are funds out there. And it is, important for students to choose the projects that are the most meaningful to them and give them the most benefit in their career path. And the funding is there. They just need to apply for it. And the benefit is that those applications actually helped me a lot with my final report and my lit reviews. So it's kind of all one and the same. It helps you out along the way. Oh, Kim, you're on mute still.
It was going to happen to somebody. It's going to be me. Thank you all. You have been such an amazing panel today. I feel like between watching your presentations and this today, I feel like I've learned so much from you all, and I really, really value it. I'm going to pass it to my colleague, Mariah, who's going to share a little bit more about our virtual conference.
Yes. So thank you everyone for attending today, and thank you, Kim, and our presenters for this discussion. First, we would like to thank all of our wonderful applied practice experience sites throughout the state, nation, and world with whom we work to improve the state of public health. The Applied Practice Experience Conference serves as a professional opportunity for our Masters of Public Health students to share their applied practice experiences and has been one of the most impactful and practical components of the program's curriculum so far. Since its establishment, the MPH Applied Practice Experience Conference has grown in stature and significance, and the college uses this event as a public health networking tool by inviting public health practitioners, partners, and alumni through the state. The key to its success lies in the student participation in this panel and the exceptional student presentations. Through contributions they have made and the benefits they have gained, the Applied Practice Experience Conference reflects the indelible handprint of the MESCOF students on public health projects and agencies. We sincerely thank you all for coming to our virtual MPH Applied Practice Experience Conference student highlight event. For those viewing a recording of this, hello and thank you for watching. There's a link form for this live event that I'm gonna put, or that Kim just put in the chat. And we would appreciate it if you could take a few minutes to complete that form to help us make this event better each time. And I can pass on to Vanessa.
Thank you. This virtual experience allows us to provide an applied practice experience conference that showcases projects from students across all of our campuses. Each student has recorded themselves presenting on their Master's Applied Practice experience. These presentation recordings are being hosted on a web page on the College of Public Health website. This page went live earlier today, and you can now access our presenters' presentation recording. And it looks like Kim already put that in the chat, so thank you. We have also sent this website link to our COPH community, as well as individually to all presenters for them to share with family, friends, site preceptors, and anyone else they would like to share it with. Presentations will be viewable in an on-demand format as of Monday until May 3rd. At that time, the presentation viewing page will be deactivated. We encourage you to watch as many presentations as you are able to during the viewing period. For each presentation you watch, we ask that you fill out the presentation feedback form linked on the presentation viewing webpage. We appreciate your support of the College of Public Health and of our MPH students. They have all worked incredibly hard on their applied practice experience projects, and we are excited for you to view their presentation in order to see the ways in which they are helping move public health issues forward in our communities. We have now come to the end of our live event. We sincerely appreciate you all joining us this afternoon, and thank you to our student panelists. We hope you enjoy watching the student presentations and have a fantastic day.